Welcome back to Singapore Tonight. More now on the government's priorities for the rest of its term. Earlier, we talked about efforts to forge a more open and inclusive meritocracy. And we look at another key focus now, giving seniors stronger assurances on healthcare and housing. During President Halimah Yacob's address yesterday, she'd called for social safety nets at every stage of life to cope with uncertainties. For more, we speak now with our reporter in studio, Tan Se-Hui.
One of the obvious thing, a source of reassurance for a senior citizen would be living in a house that is adjusted to your new needs as an older person. So more seniors requesting assisted living flats. So what are these flats and how many will be built in the years ahead?
So assisted living is really for those who want to live independently, and for seniors specifically, they're called community care apartments. And so just to give you a sense, by 2030, Singapore's rapidly aging population is going to be 1 in 4 Singaporeans aged 65 and above. And so more seniors are really requesting for community care apartments. And there's really a pipeline that's going to be developed, about 600 apartments over the next few years. We can see it in 3 different estates. One of them is Bukit Batok, Queenstown, and also Bedok. And I can see why these seniors want to live in such apartments, because it's really tailored to their needs, as you were saying, Wei Su. And so it's open flat concept. The bathrooms, for example, are also wheelchair accessible. And also it's almost fully furnished. So the seniors really just need to move in, and they can move in easily and live on their own and really live out their golden years. They also get to subscribe to a service package, and so they get round-the-clock service and checkups and basic health checkups as well. And also nearby, they will get to go to active aging centres, and this is where they get to be fully engaged. They will get to have social and recreational activities. And our colleague Sherlyn Sia, she went to one of these active aging centres, and she really gave us a look at some of the service on offer.
It's full house here at this active aging hub in Queenstown. For these seniors, it's a place for them to hang out, part of their weekly or even daily routines.
And the centre here takes on a free and easy concept where seniors can come by any time of the day, whether it's to take part in fun activities, sing some karaoke, or even catch up with their friends over some of their favourite games.
There's even an in-house gym for those who wish to get active on their own time, outside of scheduled exercise classes. It's all part of Active Global's strategy to offer diverse programs that aren't too structured, so seniors can pick and choose what they wish to do. With 3,000 clients under its care, the provider also wants to make the centre a one-stop shop that meets more of their needs.
We keep reinventing our schedules and programs to match the interests of the seniors in this community. We talk to them, we understand their needs and their interests. The programs that we're looking at, right, in terms of health screenings or functional screenings, health talks, gives them the awareness about managing their health. Preventive care is going to be a very key focus.
That's in line with MOH's push to make such spaces a node for seniors to receive health support. Singapore also wants to double the number of such centres to 220 over the next 3 years. In addition to expanding the network, Active Global also hopes to see more integration, such as through tighter partnerships with other providers for transfer of care when needed, for example, if seniors relocate.
So every active aging centre will be given a service boundary by MOH, which covers a few blocks around the position of the centre to engage seniors. We do have seniors being transferred from other active aging centres to ours as well. We offer the same services. We try to expand and then give them the services that they've already been engaged in.
And in the event that seniors don't wish to switch centres despite living elsewhere, she says there should also be smoother transport arrangements so seniors can get around with ease.
So the government is also going to offer more support for palliative care. That's an important one as well for our elderly. Is there higher demand for services like that?
Yeah, absolutely. Because unfortunately, as the aging population increases, now the death rate is also climbing. 6 in 10 people in Singapore, they die in the hospital setting, but more of them want to choose to die in the home setting. And so the government really wants to bring that number down. And so they want to boost palliative care. And to do so, they would have to upskill healthcare workers. They will also have to scale up the kind of manpower. So this would alleviate the kind of burden that the caregivers are facing at home. And so they're also looking at reducing hospitalization costs. Yeah.
Also, if we're thinking of lowering costs overall of caring for an aging population, it's not just lowering the cost of them when they are in hospital. Ideally, we should reduce the number needing hospitals in the first instance.
Yeah, that's right. Again, to give you a sense, healthcare spending is really going to take up the bulk of government expenditure by 2030. So there is a concerted effort to bring medical costs down. And so instead of treating patients when they're ill, they really want to prevent Singaporeans from falling ill in the first place. So there's a shift in towards preventive care. So they want to prevent Singaporeans from falling ill. And this program is called the Healthier SG program, and this starts in July. And so those aged 60 and above, they can sign up with their general practitioners, and they will get to have free regular health checkups. They will also get recommended vaccinations. And so this is something that I think more people want, and they want to see, and this would really also bring down the hospitalization costs. And more than half of GPs, they have already signed up for this program, and hopefully more will come on board.
Yeah, important for all of us, actually, no matter the age, reducing the number of years in sick care to preventive care. So we thank you very much for coming in and talking to us and breaking down all of that data for us. Tan Sah Hui there.